You can't have to touch the screen because it's very sensitive. Okay.
Also more.
Yes. Hello, everyone. Welcome to our population health diseases or chronic diseases and emerging technologies fly-in. Here from Washington, D.C. We're excited that our students are going to today do their hackathon. They've all have been given a different question, so they'll explain what their question is in their presentation. And we use this information to then make other informed decisions, so we look forward to this program and for our students talking about what they learned while they were here in Washington, D.C. Thank you.
Good afternoon, everybody. We're here today with Population Health Initiative FIU in the DC Fly-In. And today we're going to talk about leveraging information to accelerate health technologies. Yeah. Oh, wait. So a little bit about who we are. We're going to introduce ourselves real quick.
I'm Jenny Ayala. I'm a biology major.
I'm Aiden Jones. I'm a behavioral neuroscience major.
I'm Noel Singh Dias. I'm third year PhD student.
I'm Melinda. I'm a biology major. Sorry. I'm Melinda, a biology major.
I'm Victoria Burjan, an international relations major.
I'm Nicolas Navarro. I'm an international business major.
I'm Alina Daniel. I'm a psychology major.
Perfect. So we're going to start with the question that we were given. So how can universities leverage innovation hubs like the Johnson & Johnson Innovation Lab in DC, along with AI-driven initiatives and organizations like the Special Competitive Studies Project, as well as private partnerships to accelerate the commercialization of health technologies that address chronic diseases and emerging health challenges? So we're going to... So we're going to focus on leveraging organization partnerships on what FIU does, what organizations are doing, and how we can work together for the better health of the nation in the future.
So to start off, we're going to briefly mention and touch upon some of the existing labs that are existing under FIU. The first one being the Brain Behavior and Environmental Laboratory that focuses on cognitive function and also how our environment affects neurological function. And the second one is the Functional Precision Medicine Laboratory that tests existing drugs on guiding treatment for cancer.
And we're also touching up on the Biomolecular Science Institute, which includes the mosquito-borne diseases, which are like malaria and Zika virus, antimicrobial resistance, which deals with drugs and prescriptions, and lastly, COVID-19 investigation, which is pretty self-explanatory.
We're also going to be focusing on specifically the Functional Precision Medicine Laboratory, and Aiden's going to be expanding on the research aspect of it.
Thank you. So we will be talking about, you can go ahead. So I'm actually a part of the Functional Precision Medicine Laboratory, and we're going to be talking about it as a model in a collaboration with JLabs and how this format could be followed for other existing laboratories to expand technologies and make sure that we're actually implementing them to improve outcomes for patients, which is our goal. So first, JLabs is a great place. We got to tour it. We got to see all the resources they're able to offer. It's a great initiative, and it really offers support and scalability for existing labs. So it takes existing research, connects them with investors, provides them with resources, gives them, discounts on supplies. That really makes it easier to expand projects that can be applied, wide throughout our nation on the state level. So they focus on first building up existing research projects. And after the project is in a really good spot, they're focused on connecting you with existing healthcare systems and places where you can implement these technologies and make sure that the research that has been done is actually being used and applied to the consumer and the patient. And this is the ultimate goal that they have, is to improve patient outcomes. And while we were there, we got to learn they have a very common phrase they like to say, is that the patients are waiting. So we start with research, which is not necessarily at the bedside by the patient, but we hope that this technology can eventually be made and used to improve the outcomes there for them.
All right, so we're going to talk about a very hot topic, especially relating to the public health industry and the future of the public health industry, what it may look like, and that would be AI. So at FIU, some advancements that we've had with the research of artificial intelligence have been Dr. Wang's radio frequency identification sensing systems and Dr. Palab Mazumder's addressing population health consequences of sea level rise in Miami. AI is a tool that we're going to see every time used more in every industry, and one of the most affected industries, hopefully, will be public health. So we're going to touch on SCSP, which is an institution that we visited this weekend. And yeah, Jenny, I'll pass it on to you.
So SCSP stands for Special Competitive Studies Project, and basically what they do is they aim to leverage AI technology to help address healthcare challenges. So integrating AI-driven tools can benefit drug discovery by accelerating drug development and personalized medicine to help tailor to the specific individual to help out with better healthcare outcomes. And also with analytical predictions for chronic management, it helps tailor to them as well and to predict the progression of those chronic diseases.
So to summarize, we all discussed about collaboration and the need to take research out to the people for what it is. I do not know if you all saw in one of the previous slides when we visited JJ Labs, there was a picture that suggested the patients are waiting. And I guess as researchers, our final product is translating all that research into medicine and finally some kind of treatment for our patients. So how we plan to do that is by collaborating with private organizations like the ones that we mentioned earlier. And that happens by harnessing innovative hubs that is accessing funding. That's really important, especially in given time today. Then looking at strategic partnerships, like we can connect and collaborate with more pharmaceutical organizations that can leverage medication and provide access to drugs that might not be available readily. And then navigating regulatory pathways, FDA approvals, policy-related approvals, taking a very non-partisan approach and just going for the final good of the people so that access is improved. Real-world impact that will ultimately lead to that. And AI-driven acceleration, we already spoke about this in great detail, so I'm not going to go much into it, but it's going to tie back to how ChatGPT also helped us put this quote together where it suggests that innovation is not just about discovery, but it's about delivering real life solutions, and that's what we aim to do with the integration of AI. And we wanted to quote ChatGPT because it's been really helpful in this whole presentation. So thank you so much.
Not too helpful. Not too helpful. But thank you so much. What's up?
Is there any question?
Any questions? No? Well, thank you guys. I appreciate it.
You can come back up. There's always a question. There's always a question. So talk to us a little bit, if this is to happen and J&J were to sponsor a laboratory at FIU or develop this further, how would you want to see it evolve? Like, what are other functional areas that you believe that this could work in, and the use of the AI with it?
Yeah, so I think one really big thing that J&J has to offer that a lot of research institutions struggle with right now is that you can't do every part of the process, and a lot of things have to be outsourced. So in functional precision medicine, it combines drug testing as well with genetic profiling to provide the best outcomes. But currently, like, genetic profiling is just something that has to be outsourced and done outside of the laboratory. But at a place like J&J, everything can be done in-house with very close proximity that ultimately is going to reduce the time of the whole process and, you know, make it more efficient, and we can hopefully get it to the bedside sooner.
No, just adding to that, also facility. We might not have that kind of services at FIU, but they have a lot of equipment. They have enough technology, because the drug testing that we are doing on all the genes is very AI-driven based that uses technology, which is expensive. So J&J has access to that. At a population health level, we can only profile like 2 participants or patients per day. But if we collaborate with J&J, we can probably do like 15 or 20 patients. That's like 15 or 20 patients getting access to cancer treatment on regular basis. So that will be really helpful.
Thank you.
J&J has the entrepreneurial spirit, and now you're discussing AI. Have any of you been inspired to create or to innovate based on what you do right now in your majors at FIU by experiencing J&J and putting it all together?
I can go again. Yeah, so experiencing all these things has been really cool. I've been able to learn a lot about AI. I know that AI is something that's being worked on in a lot of spaces. And I think that the opportunities that you have to develop predictive models and, not just using one angle or one research lab's input or data into the AI is going to connect you to many research spaces and ultimately create a more comprehensive tool that can be applied and expanded, in one area with the collaboration of many.
And to add on to that, not just in the physical, practical sense, but for example, as an international relations major, AI is new and there's no regulations for it. So people, the ones of us who are interested in policy making, we want to make policies in order to protect patients as well as doctors in this AI, new AI-driven world, and to be more secure and yeah.
Just to add something onto that real quick, I think it's really interesting how we've all gotten together here in this DC fly-in. We're all from different backgrounds. Some of us have backgrounds that are sort of similar, but we have psychology majors here, business majors here, health sciences majors here. So it's really interesting how, regardless of what field you're in and how that ties into population health or public health, AI is somehow going to be affecting your industry. And the best thing we can do is find a way for it to benefit us, to get onto this new wave of AI instead of having attitudes toward it that might be more traditional. So yeah, I think that the diversity that we have and the diversity that we've seen of people that have come in, we've seen people that have worked on the Hill, we've gone to visit people that are in laboratories. However, they're all being affected by AI. The underlying issue is AI is something that is important, that we're going to see every time more in the future, especially in industries like public health, and that it's affecting all of you and all of us in some way or another.
Any other questions?
Thank you, everyone.
Thank you so much.
Should we begin? Put one on this end and one on the other end.
Oh, okay.
Like, how do you can. Oh, because Nora's doing this. So you go there. Your presentation?
I think we can make it bigger.
Wait.
Wait, sorry. I'm trying to make it bigger in center.
Oh.
Okay. Start? Yeah. Hi, everyone. We're very happy to be here with Team B. We have a very cool presentation about making future advocates through FIU. And we're, unfortunately, Debbie, Shirley, and Simon cannot be here at the moment. But we're Anna, Nora, Sophia, Amanda, and Andres. We're going to introduce ourselves very quick and then go ahead and explain to you our solution to this problem.
Hi guys, my name is Amanda Martin. I am a psychology major minoring in marketing, and I'm interested in how policy can tie into my psychological background and how I can work with that.
Hi everyone, my name is Andre Rivera Cruz. I'm a Master of Public Health candidate with a specialization in epidemiology. and I'm finishing up. Very excited to be here. Thank you.
Well, I already said my name is Ana. I'm a biology major. I'm graduating this semester. I'm going to medical school at FIU starting in the fall, and I'm also a minor in philosophy.
Hi, my name is Nora. I'm currently a pre-law bio major, and I'm interested in how the legal field and public policy intersect with scientific and medical research.
Hi, my name is Sophie. I'm a public policy major and I'm a first year, and I'm really interested on how public policy can affect individuals with disabilities. So to start off, we identified the problem, which is there is a disconnect between advocacy, research, and the community. This gap has exacerbated mistrust in science, skepticism, and the further spread of misinformation as we live in a digital world. For example, recently we have seen the direct impact that social media misinformation has had, like the recent outbreak of measles.
So, like Sophia said, there is, as we live in a world that is very interconnected, if we are in constant communication with each other, we believe that us as public health, future public health professionals, we need to kind of like infiltrate these spaces to promote and bring awareness to the topic. Recently, through this new administration, the House has passed a bill that includes a budget cut essentially for medical research. And what this means is now resources, the very limited resources, and now even further limited resources for medical research does impact institutions like FIU, that its focus is to connect research to the community. We wanted to focus on Miami as it is an international hub. Our population is extremely diverse from all types of background, and I think it is very important to make advocacy work even more important.
Yeah, so part of our issue is the lack of awareness on population health. So we believe that perhaps if we create a course with the intention of raising awareness on population health among students that aren't just trying to work within hospitals, for example, we believe that population health is something that can apply to all sectors. So we would like to ensure that we empower as many advocates as possible, as this is something that could apply to just about all of us.
We would also like to collaborate with Research America, who we met earlier in this fly-in. They're a very good organization to spread awareness of science communication and also policymaking. And we think that if we collaborate with them in sort of initiatives or maybe internship programs or just community outreach programs for students, they can understand more what labs do and also how to implement that in the real world, which is really our problem. Then we would also like to foster multidisciplinary collaboration through curriculum reforms in undergraduate and graduate education. So, for instance, introducing global health courses or public health policy courses in majors that are not necessarily healthcare related, but that will eventually have an impact on the real world, like the implications of healthcare in the real world and how they can learn about how these are applied in the federal government level.
Another solution we were thinking of is expanding the fly-ins that we currently have. So far, there are only 20 of us, and I think one of the solutions that we can bring is bringing more students from many disciplines to learn about public health. I mean, for me, I didn't really know what public health was until the fly-in, and I think with these fly-ins, students can get a more deeper connection with public health and who's involved with it.
And then at last, just trying to connect policymakers or people that do activities, yes, in this realm with researchers to start the conversation. We've spoken before that science communication is not very easy, especially for scientists to explain their research to students and so that they understand what the real world impacts are. So we think to start fostering that conversation is very important at FIU, and also just to connect students to community outreach opportunities to non-scientific audiences so that they can understand the value of population health.
Just adding on to what Anna said, specifically trying to translate, right, like a research into real impact, and it's a very difficult question to answer, but is why does the community care? Why do they need to care? Why is it important to them as well, the research that FIU is doing? So as we were brainstorming, we realized that health exists beyond hospital. Health exists beyond clinics. And I think it's important to advocate for health policy that not only affects people in hospital or clinics, but also outside. We're talking about a life course approach to preventive care and all these other stuff. We believe that FIU can integrate student and federal partnerships through university efforts to meet FIU's mission to form the new generation of innovative community leaders and advocates for public health awareness. Thank you so much.
Thank you.
Any questions? Hi.
Do you guys have maybe any solutions that you brainstormed for like intercontinental solutions of public health disparities and maybe across our borders, other countries that maybe have more social determinants of negative outcomes in health?
Yes. Does anyone? So, two of our collaborators, Debbie and Shirley, both of them expressed their interest in health policy beyond the borders of the United States. What does this mean? Protecting U.S. citizens that go through health events outside of our borders, right? So FIU, being a Florida International University, should be having this conversation and should be connecting researchers, advocates, and policymakers to start these conversations around what can we do to better our population? What can we do to help those that might be outside of the U.S. but need our help as well?
Also, FIU, we have the advantage of being, I think it's the most diverse public institution in the country in terms of nationalities and cultures. So we can take advantage of the fact that we have so many international students and international faculty too, and just trying to foster conversations between everybody to know what are the issues, not only on a national level, but also on a global level.
Thank you.
Any other questions?
I don't have a question, but I do have a statement. The last slide that you have, health exists beyond the hospital. I think that's a great tagline that sums up population health. Because when you look at that, you're like, it does exist beyond hospital. Like we have other issues with health and the whole theme with population health and what other things that we can be looking into that when you go into the hospitals that they are fighting, or they're the frontline people. It reminds me of General Hospital. So Barbara, the hospital is the setting, but there's all this other stuff going on out there. So I think y'all did a great job with that. And if one of y'all should, maybe trademark that or something.
Yeah, and that is true. That's the main reason why we said the best policy sometimes is the low cost policy. And I think reshaping and reforming the current curriculum to foster a space for multidisciplinary collaboration does help bring those issues up. Just like talking about prevention, talking about how the housing crisis is affecting health, just like what happened post Katrina, right? All these other things is bringing awareness to these topics and starting the conversation, because what we don't talk about, it doesn't exist.
I think another good thing that goes into this fine is also for chronic diseases. And with the quote that says health exists beyond hospitals, you can also look at how our policies and how our government protects those with chronic diseases or other disabilities. So it's really true. Health does go way beyond hospitals. It goes into our government. It goes into our policies that protect those that might not be able to protect themselves because of these different diseases and disabilities. Anything else?
Thank you so much.
Thank you.
Okay, hi. We are Team C, and we're going to talk to you guys about population health. Really quickly, my name is Sophie Ashbrook. I'm a fourth-year biomedical engineering candidate, my PhD.
Hello, everyone. My name is Shalata Okuna. I am a first-year aspiring attorney on the pre-law track, hoping to double major in political science.
My name is Alyssa Sandoval, and I'm currently a communications/journalism major. I graduated this semester. I got into grad school, currently working for the federal government, and I'm just hoping to continue my way on there.
Hi, everyone. My name is Jerly. I'm majoring in health services administration, currently in my last year.
Hi, everyone. My name is Samarsh Pierre-Charles. I'm a psychology major on the pre-medical track, and it's lovely being with you guys.
And hi, everybody. My name is Hannah. I'm currently a biological science and natural applied science major with a pre-med track, and I'm currently a second year.
Hi, everyone. My name is Kanisha Sanville. I'm majoring in natural and applied science with a minor in biology and psychology, and I am a third year.
Hello, everyone. My name is Claudia Lewis. I'm currently a second-year sophomore, majoring in the international business with an interest in politics.
Okay, so getting right into it. Our question was around how we can bring back our knowledge to FIU and cultivate kind of a community that believes and advocates for public health, and how we can actually reach out to our senators and the organizations within the Miami area, taking back what we learned from DC. So we identified our problem as a really overall, there's a lack of education surrounding population health at FIU and within the community. And we kind of went to work on our call to action, addressing that, coming up with ways to reach out to people, and really putting the word out there on how important population health really is.
So with such an ambitious problem and such an ambitious issue, we targeted a couple of goals. So one, advertising to Gen Z through social media, then having these expos or even networking events so that we can interact with the whole FIU community across different disciplines, from engineering to medicine to even marketing, to make sure everyone across different diasporas can meet public health.
And for our social media campaign, we do have an example on how we want to meet everybody where they are. I think you have to.
Oh, sorry. Oh, so sorry. Trying to make it bigger.
Oh, I messed up. Sorry.
No worries.
impact that we have on our community in South Florida in particular and what FIU is doing as research, and that it's really important and significant to our greater Miami-Dade, Broward, Monroe communities, and what it means for FIU in general as a forward-thinking, innovative, unstoppable institution.
It means a holistic community development having to do with physical, mental, and emotional health of society.
Population health means to me taking care of the world, one person at a time, health-wise, all the issues.
Hi, my name is Judy. I'm participating in FIUTC in the population health flying, and I would love for you to get to know and learn what is population health.
Hi, my name is Keisha Samuel, and soon coming to FIU, we have a population health happy hour where you can come network with agencies here in DC or even in your state.
So that's one example of what our social media campaign would look like.
And so a buzzword from that video, buzzword is what we learned from this fly-in today, is happy hour. So with happy hour, we'll be hosting 1-hour sessions, hopefully maybe even every month, where we expose our students, our whole school population, including the faculty and everyone involved, on what population health is. And so by doing this, we're hoping that with every happy hour, we'll have different organizations on campus come in. And this can involve our FIU DC, where you can promote your fly-in, student experiences, SGA, and as well as all the other clubs that we have on campus. Medical, population health, policy, anything, we have it.
And with this happy hour, we'll be hosting a bunch of different topics within population health, from students, alumni, faculty, government officials, and even more. This will allow us to be able to continue growing our influence in not only FIU, but across the entire nation. And it'll allow us to make sure that the people that really matter, all of us, are able to get what needs to get done.
And wrapping everything up, we are looking at a conference fair because what good would these happy hours be if they didn't lead up to a grand event? The conference fair is really where all of our skills at FIU and DC come into play. We want to make sure we get those big players, Research America, J&J, government representatives, would have the opportunity to come here, network with students, and we could all learn from them. This conference fair would be an amazing opportunity to get the most educational value out of this population health initiative.
So to wrap this all up, I believe that it's a very crucial matter that everyone should get informed with the population health. Me personally, I didn't really know much about it, and I could feel like my colleagues here as well, they also agree. But population health is like a variety of things, not only just health-wise, but policy and government. And I learned that a lot throughout this fly-in, and I'm very fortunate to learn that. And we all just come together and just learn more things. And I feel like when it comes to social media, emails and news, we could put that out there to get other students as well as more informed for this fly-in, because I feel like it's very helpful and eventful for stuff like that for the future and for us as a whole FIU and everyone to understand and know what population health is.
And with that, thank you, and we look forward to seeing you at our population health happy hours.
Thank you.
Are there any questions? Yeah.
From my understanding, the happy hour is really something to expand within FIU, and then I was more curious about the conference fair. So would you be trying to make initiative and efforts to not just expand to FIU students, but bring in people and collaborators outside of FIU to these events?
Yeah, I think that's a great question. So our kind of thought process was meeting people where they are, which is kind of what we've all been talking about these past couple days. So our thought was, Gen Z doesn't really check emails or watch the news, sorry, but they're on social media. So let's meet them on social media, promote events, bring them to happy hours. You're way more likely to go to a happy hour than you are a conference or at first, you want to go and you want to network and you want to get something out of it and you want to be able to socialize. So build the community through the happy hours, and then once we have a community kind of built, move back into this conference style to really like push that education, bring people from all over kind of the industries, so private sector, big pharma, more of the government agencies, as well as FIU faculty, staff, DC office, and students as well, to collaborate and really get these ideas across from population health.
I just did want to add on to that, actually. I agree a lot with her perspective and the group's perspective of really meeting people where they are. First time around, we do want to have a lot of these government officials and older people, but we want to get Gen Z people on the scene. After a while, we want to identify student leaders, maybe send out an application, reach out, and get really people who are involved in population health, like student ambassadors, FIU population health ambassadors, so Gen Z can be talking to Gen Z. I think it'd be fantastic. We'd be talking in our own language and it'd be easier to bridge that connection.
Anything else? Or Hannah?
And with that, with the happy hours, we also want to build up to that conference fair. Build up that excitement, build up that knowledge on population health and everything. And so that's why we have the implementation of like those happy hours.
We feel like the happy hours will be a great opportunity, as Shalat brought up earlier, to include Gen Z in here. We want Gen Z to be able to feel comfortable and coming here to be able to share their perspectives on the population health and to understand why it's important. And the best way to show them why it's important is to show them a way that they can understand the best. Like you brought up earlier, we use social media. Everyone here uses social media way more than we would use our email. So if they're able to find out about the importance of population health through social media, a medium that they use a lot more, then that's a win, because we're able to be introducing the importance of something through a medium that they can understand best.
Is there any other questions? What's up?
I actually have two questions for y'all. The first one is, I saw y'all interviews and you talked about your articles from the beginning. How do you believe, now that you're at the end, how do you believe all of what you've learned has tied in to the time when you did your interviews and you were talking about your article?
That's a wonderful question. How I believe that all this ties into each other is it allows us to see that population health isn't like a group of B said, isn't just health. It's not just about the hospital. It's not just about one thing. It's a whole different community between government officials that create policies, hospital workers and medical professionals that are able to treat people, and all different types of people. Patients are the priority, and that should always be the priority. And population health isn't just the need of the medical help that they need, but it's also how they get it and how we can ensure that everyone gets it.
At its core, what got me here and what got all of us here was that group interview. We talked about our articles, we discussed them, and we presented them in a very concise and engaging manner for all of you to think, oh, I think they're pretty good. We should bring them to DC. Now, take that concept and multiply it tenfold, because we did the same thing several times over. We talked to people in organizations. We talked to J&J. We talked to Research America. We talked to those organizations, and at its core, what did we do? We talked to them about our ideas, our concepts. We took what we learned from that group interview and we did it a bunch of times. I think that's really what comes into play here. That's how we managed to get that knowledge across. You selected us based on our communication skills and our research. And this trip was really the foundation for us to skyrocket into the future, into being great leaders in DC, wherever that may be.
Did you have a second question?
Yes, you're talking about Gen Z, right? And as you may know, a lot of social media is being restricted, especially at FIU. How else would you touch Gen Z despite the restrictions?
Yeah, so I think a really big thing with Gen Z is meeting them where they're at. And kind of like I said, like I do understand that there are restrictions on social media, but at the same time, like as somebody who runs social media for my lab, like we've seen a really great increase in science communication just by easily being able to get things across. I think that outside of social media, there's other ways like emailing through the organization, like holding things on campus for the FIU population itself and like stopping people along the way, working with the other clubs and organizations that are a part of FIU, getting the word out socially. Like I know for me, I'm going to tell all my friends that they should apply for population health fly-ins because I had a great experience. And I think that the word of mouth is also just as valuable in the Gen Z culture.
I actually have a pretty fun idea, really piggybacking off what you said. It's true. Social media is getting banned all across FIU, and that is a problem. So which means, why can't we bring them to us, right? For example, we had a Panther Expo recently, Panther Games Expo. We brought Hungry Box, which was a Twitch streamer that's very popular. A lot of gamers came around and happened to have a meet and greet. I think a good idea would be bringing influencers over to FIU if there is an opportunity that are involved in population health, that are educators, and people may want to set up a meet and greet to meet these influencers they care about. And that would bridge the gap, again, because a lot of these influencers are Gen Z. They'd be speaking in our language and we'd be able to speak to them like colleagues. I think that'd be a great opportunity to really reach them, even if social media isn't as accessible anymore.
All right, thank you.